Yeah. Uh, Hello, everyone. Thank you again for joining. We are here again for another session on medical cannabis. Today, we will be discussing about gynecological disorders. So, let me just quickly start the slide and thank you again for joining in. We all are very much excited and feeling motivated every time you people join us with this initiative. I think there are very less doctors still in India. We need more and more to focus and to take it forward. So, as far as cannabis and gynecological disorders are concerned, we need to understand that there are certain dimensions and certain aspects which are uh, just prior to the presentation, to starting the presentation, let me discuss certain aspects and then accordingly we can start. So the first and foremost aspect I want to in fact, when I was going through the preparation and when we discussed about having this session today, so what I realized is there are so many aspects which are there as far as cannabis and gynae disorders are concerned. And when I was preparing the presentation, so there is so much of information. I was reviewing all the studies and all the research data which is available. So there are so many aspects which are there which we need to understand, and sometimes we have to also take it forward in terms of what exactly is going on. So what I decided is we'll start today and we will have another session next week on the same topic, because there are 3 4 aspects where if you if you do a research and if we see that extensive work has been done, extensive research has been done as far as medical cannabis and gynae disorders are concerned. So there are indications which we'll be understanding today, like for example PCOS. So many aspects are there as far as PCOS is concerned, and widely the research has been done, and we have seen that in data also patients are getting healed. However, apart from that, one primary reason and one primary uh, like uh, indication which is more prevalent and which is many times people are referring and having gynae issues in as far as the medical cannabis medications are concerned, that is pain management. So pain management and related issues like endometriosis, dysmenorrhea, many other issues are there as far as the pain management in gynae disorders are concerned. So that is the primary reason for starting cannabis in many cases we have seen worldwide. I will show you some data also today, in which we will understand that pain management is the primary objective, and patients have got relief as far as pain management is concerned. So pain management actually related to ECS is the primary reason, is the primary, I will say, issue where people have started medical cannabis. So that is one thing. Then PCOS is another aspect is there. Certain kind of ovarian cyst along with PCOS we can understand. Then endometriosis is there. Certain kind of malignancies. Cervix cancer is one of the most common as far as gynae disorders are concerned. We have seen overall in the studies, in the research studies. So there are each disease we need to understand. See, we know that it will be working. We know, as per our experience, we have seen in clinic that when we are giving, and I repeat that any treatment should have the standard of care medicines as far as Ayurveda is concerned. And along with that, you can have medical cannabis, and it's an excellent catalyst. Sometimes we have seen that earlier we used to get healing in several months, but adding medical cannabis enabled us to get healing within 3 4 months, sometimes in many cases, and without any side effects and without any issues. So that is also we need to understand, and accordingly we need to position medical cannabis treatments and modalities along with whatever the other treatment options you people have. So my request to you is, let's have this session today. Let's understand that what are the various gynecological disorders in which we can start, and I request all of you to please start having this as far as a remedy is concerned, a solution is concerned, and those who are not practicing gynae also can recommend to their female patients also. And all the doctors who are practicing gynecology in their practice can always take it forward. We are practicing exhaustively in Ayurveda. In fact, to be very frank, when we started our practice, this particular topic is very close to my heart, because when we started the practice and we realized, with due respect to all the pathies, I don't want to criticize any pathy here, but we have seen that there are not as such solutions as far as gynecological problems are concerned. Only sometimes painkillers, hormonal pills, very limited solutions are there for many gynecological disorders. And in Ayurveda, we have so many effective herbs, effective medicines available if we are using with the understanding of the reasons why these issues are there. And we are able to manage very well. In fact, our initial several cases, several success stories were there around PCOS, ovarian cysts, uterine fibroids, infertility, dysmenorrhea, leukorrhea. So all these cases we are in fact dealing in our clinic also on day-to-day basis, and we are getting very good response. So Ayurveda definitely is, for as per my experience and as per our experience in clinical life, that can be the first line of treatment for various gynecological disorders. So on that note, I will start this presentation today. As I said that we have realized during the preparation that we have second session, same topic next week as well. So please join that also. So if we do a overall scenario, we do a overall research analysis. So we have got this particular study across the females of United States, because there the maximum prevalence, and this may include the recreational aspect as well, because in some states it is approved recreationally also. Otherwise, mostly the medical data is there. So you can see that around 1,000 was there, female was there in this sample research survey. And it has been asked that if they have used cannabis in any gynecological condition, and you can see the significant rise in the percentage when there is a pain issue, like pain conditions or pain in pregnancy, gynecological cancer pain. So it is huge. The difference is huge in terms of percentage. Dysmenorrhea, again, endometriosis 75%, pelvic pain 80%. So all these are pain conditions. Around 90% are using as far as cannabis is concerned. So pain management is one of the very effective tool. And the problem here is when we see that many females are taking the other solutions, the allopathic solutions, sometimes, be it the NSAIDs, mefenamic acid, like Meftal and all. So sometimes there are side effects, and sometimes there are infant issues related and arising from those medicines rather than their own condition. That is a very common aspect which we need to understand, right? So their pain should be relieved, but their condition and their issue should not be hampered by taking any particular painkiller which they are taking. And that in that scenario, cannabis is very effective. In that scenario, we have seen, for example, it's a common finding. I don't know, maybe you can share your findings also in this session, that when some female is taking specifically Meftal spas or that kind of ingredient during the second or third day of the cycle, when the pain is very acute and they need to manage in some cases, it is reducing the duration or the frequency or the quantity of the normal flow and cycle, and it is disturbing their cycle as well gradually. With cannabis, we have not seen that kind of side effect, and pain is also manageable. There are some local application products also coming up. Many companies are planning to launch that. I think Ananta is already having that as well. So maybe you people can talk on that also. Vikram, you can give some light on that as well. Otherwise, I have seen that internal administration as well as local application is very effective as far as pain management during the menstrual cycle is concerned, and other indications also where pain is the main problem. And while healing the pain, while giving relief in the pain, there is no as a side effect, and the root cause is also sometimes getting addressed. So you'll understand in the forthcoming slide today as far as the ECS system is concerned. Then again, many issues are related to pain, be it the IUD insertion, surgical abortion, cesarean delivery pain, vaginal delivery pains. All these you can see that pain is the main issue, and cannabis has been used for those cases. Then sexual dysfunction, infertility, irregular menstrual bleeding, PMS, and all these issues. Also, we have seen PMS around 74% females are using. So it is quite prevalent, and people are using it in across the countries world. And in India, it's just started. So my request is, after this session, maybe you all can prescribe and can recommend this particular medicine, that is cannabis, to all the females who are suffering from various type of pain, various type of gynecological disorders. And when we have seen that in Ayurveda, as I said, and I started initially, the problem in Ayurveda is we have excellent solutions for issues. Like, for example, if we talk about this endometriosis, we have very good solution for endometriosis in Ayurveda. But the immediate pain address and the immediate pain relief should be there to them, and then they will stick to Ayurveda treatment, and within few months we can able to heal them. So that we all know, right? I don't like want to take you on those aspects. We can have a separate session. We have done some sessions on Gynae in Ayurveda on our platform. We'll be keep on doing that. So that is a separate discussion. Today, our focus is on cannabis. But the point is, when we want them to stick to the Ayurveda treatments, and ultimately in a private practice setup in a clinic, the challenge is patient need to stick with you. Patient need to be with you through the entire journey of their treatment. But if they are not getting immediate relief in the pain, sometimes they tend to divert, or sometimes they think that, okay, maybe Ayurveda is not working. So for that, cannabis is an excellent solution, that from the day one, it will be giving relief to their pain, and then they will at least follow the entire Ayurveda treatment to get resolution in whatever the issue they are having. So that approach we are using in our clinic, and we are getting a very good result. Now, ECS is the main responsible system, and in gynae also we will understand. So we need to understand more about endocannabinoid system. Already we have discussed that it's an homeostatic system, and many physiological and pathological conditions are related kind of. And we all know that ligands are endocannabinoids, and with the phytocannabinoids and synthetic cannabinoids, they are kind of binding. And CB1, CB2 receptors are there. I think we all know about all these aspects, so I will not be getting in detail. But ECS is the main responsible system again, and it regulates almost all levels of female reproduction. Please kindly note this. We had a discussion around this in the last session when we discussed about the contraindications, and we clearly mentioned about the pregnancy and the lactating mothers. So during the pregnancy slide, we were discussing that as far as the female reproduction is concerned, ECS is involved till the level of, in fact, if some female is getting conceived. So the placenta level also, ECS is involved, and we have seen that cannabis is getting to that level as well when somebody is taking, if they are pregnant. So almost all levels of female reproduction system ECS is regulating, starting from the oocyte production through the partition. And dysregulation of ECS is associated with several issues, gynecological issues, starting from the infertility to the cancer or many other issues. So ECS is always there. And when we talk about cannabis, when we talk about cannabinoids, so cannabinoids are basically influencing the dysregulation of ECS. Cannabis and cannabinoids present in the plant are kind of repairing or healing the entire system, which is somehow getting dysregulated or irregular. And that's why we have seen, so on one side, as I said, on one side it is managing the pain, on one side the mechanism of pain management is working, on the other side, as ECS is also responsible for the female reproduction, it is also healing the cause, it is also working on the root cause. So dual benefit we are getting. One, we are getting the pain suppression. I don't want to use that term because it's not actually suppressing, it's healing. But yes, at least for initial few days, the pain will be reduced. So the patient is getting relief in the pain. So that is also we are getting from the cannabis, and cannabis is also healing. And we have seen that when it is like managing the dysregulation of ECS. So basically what it is doing is, it is, we all have understood that it is working at a cellular level and binding with the receptors and increasing the neurotransmissions. And in that process, if we are giving other herbs also, so as per my clinical experience and clinical findings, I have realized that maybe this is acting as a catalyst. योगवाही आयुर्वेद में इसको बोला गया है. तो बाकी भी जो herbs हैं जिसको हम gynecological disorders में use कर रहे हैं, patients को दे रहे हैं, तो शायद which we have seen is ये उनका absorption भी better कर रहा है, because PCOS के cases में we have seen कि जहां पर जो cyst 15-20 या उससे ज्यादा साइज के होते थे उनको 6-8 महीने लगते थे, with cannabis we have seen within 3-4 months sometimes it is getting reduced, or sometimes few cases 2.5-3 महीने में भी हमने देखा कि नॉर्मल हो गया cyst का साइज. फाइब्रॉइड्स के कुछ केसेस में हमें स्पेसिफिकली रिजल्ट्स मिला. पहले थोड़ा सा फाइब्रॉइड चैलेंजिंग रहता था, but with cannabis we have seen good results. So the point here is it is acting as a catalyst as well. So on one side it is also itself healing, the herb also itself healing. On the other side, when we are giving with other ayurvedic medicines, it is acting or maybe sometimes enhancing the absorption of other herbs as well in the cells, which is giving us the better result and quicker results as compared to the like previous durations of healing which we have seen in the conventional treatment modalities. So that we need to understand, and accordingly we need to take it forward. Also, we have seen a very important finding, and it is very much significant for Indian context, that systematic review revealed that many women who are using cannabis products, combination is working very well. It's like it's not only CBD or THC, it's like the combination of CBD and THC means the full spectrum. So they are using for chronic pelvic pain, vulvodynia, endometriosis, gynecological malignancies, many issues which they are using. So the combination is working well. One of the most common reasons was definitely pain management. In many cross-sectional studies, we have found that pain relief was there, and especially among women who used a combination of CBD plus THC compared with either cannabinoid alone. So we have seen in many other diseases in past some time, researches are now coming up that full spectrum, the entire plant, the entire spectrum is always better than the isolates, that is CBD or THC or any other. So that means the full spectrum practice should be the focused one rather than focusing on one isolate, which is the finding of many gynecological studies as well. And in India, we are getting full spectrum extract. The medicines which you people are using is having full spectrum extract, full spectrum leaf extract of cannabis as far as the internal medicines are concerned, and you have external oils also, which predominantly we are using. So that also ensures that the pain management and other issues are getting addressed. So that is the finding, and we all are in fact I will say lucky that due to Ayurveda we are having the full spectrum medicines rather than the isolates, which in many Western countries are still a challenge to get the full spectrum medicines. As far as PCOS is, so this till now we have understood that in gynecological disorders, ECS is the main reason through which it is getting, like we are getting healing. Predominantly, the pain management is the key, and if we are managing the pain, the other related issues and the other related diseases will also be managed accordingly. Now let's understand one by one. So let's take PCOS for the day today, as I discussed initially. So PCOS I will discuss in the next 2-3 slides in detail, that how it is helping and how it is healing the PCOS, which we have compiled with whatever the research available worldwide. And I will share some of my clinical experiences also. In next session, what I suggest and what I like recommend is, along with this, let's have some real-time case studies. So I will pull couple of case studies we have in our data, and we will show to you in the next week session, along with other indications, that is endometriosis, dysmenorrhea, then certain kind of malignancies of gynecological system. So we will be discussing that in the forthcoming week. But today, let's have a brief discussion on the PCOS. So that is what that was the some basic idea about cannabis and gynae disorders. So again, CBD specifically, because see what happens in West is they do more research on CBD, but again, as I said, the full spectrum is working better in many cases, especially in the pain. But we have some studies, especially for the CBD, as far as PCOS is concerned, and we have seen that CBD helps in the hormonal imbalance in women, and it also elevates or it also improves the production of hormone, that is cortisol, and also inducing the regulation of hormones. So CBD are like CBD supplements and hemp based ingredients or food are very effective, and medicines also. CBD also helping in conquering the premenstrual syndrome, and it's in the study that it also relieve your mood swings, and it provides the mental calmness. So the stress, anxiety, and the psychological health is also very important with PCOS, which we have seen. We in Ayurveda also sometimes give certain herbs like ashwagandha, or to some extent, to some cases, I have to give Manas Mitravatkam or any other medicine for that matter. But again, the psychological health is very, very important, and it also helps in relieving the cramps, the bloating, and all those issues which are there in PCOD. And it also helps in the anxiety and insomnia, which we all know. Insomnia, we had a session last week. So if the person is sleeping well, definitely it will help them in the PCOS. Now, if we understand more, so basically PCOS is a metabolic and endocrinal disorder, and I'm just digging a bit more in detail. So what happens is the pathogenesis only recently connected to the ECS, the endocannabinoid system. In some recent studies, it has been established that the levels of AEA and 2-AG were elevated in peripheral blood mononuclear cells of women with PCOS. And AEA and 2-AG are the cannabinoids which are available in the human body. So these are the human cannabinoids, you can say. The plant cannabinoids are CBD, THC, and all. But EEA and 2-AG, I think the first session we mentioned detail in that. So I request all of you to just go to that video and see about these cannabinoids. But right now, I just want to convey that in pathogenesis, it has been established that the levels were elevated. Means the PCOS women, the people, the females who are suffering with PCOS are having some relation with the ECS system. Also, in the research, it has been founded that the reduced FAH expression in the endometrium of patients with PCOS and increase in AEA plasma levels, because FEA is mainly involved in the AEA degradation. So means it is degrading the human cannabinoid. So again, we have seen in some studies that elevated plasma levels in connection with lower FAH activity results in the ectopic pregnancy also, which is linked to the PCOS. So that means if we increase the endocannabinoids in the body, it will definitely again impact FAH and other issues, and then it will help us in healing the PCOS cases. So now how we have to do that is, because see, the problem here is again, when the levels are increasing means what? The levels are increasing means there is some pathogenesis. So the endocannabinoid system is dysregulated or sometimes having issue. So the conclusion is the dysregulation of ECOS is involved in pregnancy complication of women with PCOS. And by giving plant cannabinoids, we have to regulate ECS so that the AEA and 2-AG level will come to the normal and the ECS system is regulated. So the regulation of ECS system is done by the external cannabinoids, the plant cannabinoids, CBD, THC, and around 100 cannabinoids are there in the plant-based cannabis medicines. So that we need to do so that the ECS system is being regulated and the AEA and 2-AG levels are being reduced and PCOS ultimately is getting relieved. So that is the theory which we have seen in many research studies. Also, it has been established that high ECB levels, insulin resistance, all these are very common pathophysiology in PCOS, and it also related to hepatic stress and liver damage also sometimes. So again, hepatocellular injury and all these markers are related sometimes in the PCOS cases. And weight reducing therapy also helps, because PCOS, again, as we know, is a lifestyle disorder also, and we always suggest to all the females to reduce weight. So with cannabis, we can do the weight management as well. And sometimes we have seen in many cases the inflammation, the interleukin theory and interleukin research has been established during the COVID era as well. In the second lockdown, I remember there was one study where it has been mentioned that cannabis is playing a very crucial role in terms of the cytokine storm related to the interleukin. So in this PCOS also, we have seen that it is playing a very crucial role. And as far as the weight management is concerned, as far as other issues are concerned, this is working very well. So there has to be more and more studies, there has to be more and more research to be done. So I'm not saying today that this is the only solution you should start giving to all the PCOS patients and you will get relief. No, but at least there are footprints, at least there are impressions, there are some findings that ECS system is related to PCOS. ECS system, when we regulate that with the plant-based cannabis medicines, we are seeing results and we are seeing healing, and that we have already, I have conveyed this in some sessions previously also, that specifically with PCOS, we have seen that earlier we used to give medicines of Ayurveda along with the other whatever standard of care, but without cannabis. Last year, say 2020 or 2019, generally it was taking around 6 to 8 months to get a complete healing, or sometimes a minimum level of like minimum size of ovaries which we can achieve to a particular case, and the cysts are getting healed. The ovaries are near to the normal size, and all the clinical symptoms are also getting resolved or healed. Or sometimes if there are couples, so females are able to conceive as well, which they were not able to do due to the PCOS and other issues. So that was the endpoint, and generally we were taking around 6 to 8 months to achieve that. But now with cannabis, in last 1 year, in 2021, exhaustively we practiced in many cases, so we have seen that at least 50% reduction was there. So which is around 3 to 4 months, 5 months, we are getting very good results, and healing is there in the ultrasonography reports as well as their symptoms, clinical symptoms and all. So that is our finding. And second issue was with PCOS and with other gynecological disorders. Earlier our patients were used to come to us, so only one issue we were having, that the acute pain. So sometimes we have given them some Ayurveda medicines. I'm not saying there are very good painkillers in Ayurveda as well. Rasoshadis are there, some herbal medicines are there, some vish dravyas are there, which are acting a very good as a very good painkiller. So it's there, but you all know that. But right, still with cannabis we are able to manage very well, and as it is also helping in healing also along with the pain management. So after that we have seen that patients are lasting with us, and we are able to heal them with, because our challenge is we are just a clinic, OPD clinic with some medicines only. We don't have any healing therapies or panchkarma and that kind of stuff, which is very effective in several gynecological disorders. So that was our challenge. So in that scenario it is working very well. So my request to all of you is, please do some more research on your end as well. I think we have several questions we will be taking quickly, although uh, prior to that I request Vikram to maybe add on to certain things. And I think, Vikram, you people are planning something around I think some menstrual pain product. I am not right now aware when you will be launching that. So, but maybe I think you discussed at some event. So maybe you can aware about doctors on that as well. And any feedback, any testimonial you have, or maybe your doctors who are connected to you. And then we'll go to Dr. Amit. I think he has raised hand, and there are a couple of questions also in the chat box. So we will go to Vikram. You are there. Thank you. I think Vikram is not available. Maybe I'm just quickly taking some questions. So where do we get CBD capsules and THC oils for patients? I'm practicing Ayurveda. Okay, doctor. So you can just quickly send your details in the chat box. I will ask the team to connect with you. Vikram, if you are hearing me, so maybe you can just connect with Dr. Avi Pandey. And let me just make co-host to Dr. Amit Munjal as well. He wants to ask something. So Dr. Amit, you can raise your question. Any other doctor wants to ask anything, please let us know. We can have a discussion around that. And then maybe we can proceed for the conclusion. And we have another session another week in which we will be discussing more about certain other gynecological disorders. So let's proceed step by step. So Dr. Amit, you can speak, please. We have made you the co-host. And any other doctor wants to ask anything, wants to interact, please feel free to raise your hand. We will ensure that you can also share your inputs. Dr. Amit, you are there? Hope I'm audible. I think Vikram, you are there?
Yes, Doctor, you're audible. Everything is
yeah. So I was just saying that maybe you can quickly share about the menstrual, I think cycle, some product you people were launching or planning to launch. So we can
yes.
about as well, and any other feedback or testimonial on gynecological disorders from your patients or from your network or doctors. You can share your input also.
Yes, in product wise, even I know we have the data of the gynecological disorder and menstrual issues. It's pretty high. And that is why, we have just actually come up with this product, which will be available in the next 4 to 5 days, which is it's a cramp reliever product. It's a roll on. It's a very handy product. And with the cannabis infusion in it, we are really hoping that it's going to help a lot of people. And menstrual cramps and gynecological disorder is something which we also plan to do a clinical trial on, which is in the phase 2 of this year. The first two are on pain and insomnia, and I think it's a big issue, and it needs to be addressed properly. And I think cannabis can really help in this pain management wise. Otherwise, this in fact, I've seen this in my house also, that with with the females who go through severe pain problems, and जिनका pain थोड़ा ज़्यादा होता है, they get very oftenly addicted to these painkillers, and which has a long term effect on the body. And I think with this, by using cannabis and putting them on a plant based medicine, I think it's one of the best alternatives we have. Particularly, I do not have a case study right now which I can remember about this, but yes, I know a lot of doctors who are connected with us who have used cannabis from Trilokya Vijayavati to even the external application oils, and in some cases the tinctures also, for handling the pain around the menstrual cramps or PMS, or all these other issues. So I know this works, and wherever pain is and ECS system is involved in, cannabis will play a very important role and a very positive role in this, as you also explained in the pitch. So yes, I hope that this product which we're coming out with is able to help this problem, and it's a big issue, Doctor. We need to address it, but cannabis can address it very well. So that's what we have. I mean, we have all the products. I mean, we have from the external applications to classicals, and now particularly we are targeting this one and hoping that in tomorrow we are able to come out with better and better products. But yes, cannabis, I think, in my opinion, will play a very big role in addressing this issue.
Right. Thanks for this update. Dr. Amit, you want to add on to something or you want to ask anything? Please unmute yourself and you can. Thank you. And any other doctor wants to ask anything, please let me know. And I think Dr. Dipali, okay, so Dr. Dipali, what I will suggest you, you can maybe rewind the session. It's available on YouTube as you have maybe joined later on. So, but yes, we have another session next week as well. And yes, so the question is, we can standalone manage the dysmenorrhea and acute gynae cases of pain and all along with medical cannabis, or should we use in combination? So see, as far as medical cannabis management is concerned, in gynae disorders, and especially as you mentioned about the pain management, sometimes we have seen, see what happens is whenever somebody is coming to us, there are two aspects. One is, as you mentioned, that the dysmenorrhea or some pain is there, but the reason for the pain and should be identified. So suppose if the reason is identified, and endometriosis for example, or PCOS, or any other ovarian cyst or uterine fibroid or whatever, so the standard of care Ayurveda treatment should always be there along with medical cannabis, that we have seen in our clinical practice. And it is because ultimately end of the day we need to heal the root cause also along with the pain. But yes, for immediate pain management, for acute pain and all, internal cannabis as well as local application oil you can use. Trilokya Vijayavati again is for mild to moderate, but for acute pain, for immediate relief, either use the tinctures or the VJ75. Both are working very well with the clinic patients. So that we need to understand, and accordingly we need to take it forward. Otherwise, you can just quickly rewind the session. We have discussed some more aspects on this topic in today's discussion. Literature, material, books, and all. Shortly, you all will be getting that. Dr. Ipsita, Dr. Vaibhav, so all of you will be getting that very soon. Okay, so Ayurveda, Pharma, antacids, sometimes acidity in cannabis, Dr. Rizvi, right? So yes, gastritis and acidity, constipation, dry mouth, these are some issues some patients can have when we start them the cannabis. So as I said many times, it is Pitta Prakopakam Ushnavirya Oshadhi as per the Ayurveda is concerned. So you have to be a bit cautious. अगर पित्त प्रकृति में आप बिना पित्त शामक औषधि के इसको देंगे तो एसिडिटी तो होगी डॉक्टर रिजवी, तो उसमें प्लीज यू हैव टू एंश्योर दैट इफ समबडी इज स्टार्टिंग कैनबिस तो उसका थोड़ा सा पित्त उसका प्रकृति का थोड़ा निर्धारण कर लीजिए. उसका विकृति है तो दोष किस लेवल पर है, नाड़ी परीक्षा कर सकते हैं, बातचीत करके लाइक यू कैन रिजॉल्व द एस्पेक्ट्स, यू कैन अंडरस्टैंड द एस्पेक्ट्स ऑफ द इंडिविजुअल, एंड उसको प्लीज साथ में जरूर you need to give some kind of pitch shamak oshadis, and वो जरूर दें तो उससे acidity, gastritis and other issues will not be there. That you need to understand, and accordingly you need to take it forward. सारे patients को नहीं होता, कुछ को होता है, आपने भी लिखा है. So that is the challenge, and that as an Ayurveda doctor we need to understand and accordingly manage. Right. I think Dr. Vaibhav, details have been shared, so maybe you can just connect with them, and otherwise you can share your details also, so that the company people can connect with you, and other doctors also who wants to connect. Please let us know. Email ID, mobile number is there in the Zoom chat box, so you all can connect directly as well. Right. Thank you all of you again, and whosoever has joined a bit late, please go to our YouTube channel. The entire session is available there. You can see, and the previous sessions are also available there. And next week also we will have the same topic, that is the gynae disorders. We'll be continuing that because there are some gynae issues which are pending. So we'll be discussing that in the next week. And thank you again for joining today. Have a great weekend ahead. Thanks.
Thank you, Dr. Saab, and thank you to all the doctors. We'll be catching you guys again on next Saturday. We'll continue some continuing topics, and we're gonna bring up some newer ones also. And once again, Dr. Piyush, thank you so much for consolidating the knowledge and taking out your time and making this effort so that we can have these continuous sessions. Thank you, guys. Have a great weekend.
Thanks.